Okay, so Raymond Hillquist. Raymond is from Finland and has experienced socialized health care, lived under that, and we had a chance to talk a little bit ahead of time, and was telling me in Finland, if I remember correctly, they have kind of a half and half situation where the middle class is under private, but the seniors and the unemployed are under socialized medicine. But in Sweden it's totally different, and so I'm sure our audience would be interested to know the difference between the two and your experience with socialized medicine.
Yes, as you know, Finland is up there in northern Europe, one of the 4 Scandinavian countries, north from West Norway, Sweden, Finland, and east comes to Russia. East side of Finland is Russia. So, talking about, first of all, I saw personally, generally speaking, how socialism came to Finland 1960s. And 1970, when I was a very young, small businessman, the things it was told to me that it was because government health care expenses was growing the most, the greatest entitlement in Finland. The taxes went up, and it hit the small businessman, and I started to feel very uncomfortable in that environment. In 1973, with my wife, we emigrated to USA legally. Thank you. And talking about anything what is product of socialism, including healthcare. By the way, it's all medical care. Healthcare, only thing I know, only country where I know healthcare ever has existed in ancient China, where the Chinese medicine man kept you health, kept you wellness going on, and you had to pay that time when you became sick. You stopped the payment, and he had to pay from his whole pocket if you back. So that's a real health care. But we are talking about here medical care, which means when you get sick, you are taken care of. And now, all features of what the socialism is bringing. The model is in old communist Soviet Union. And talking about Scandinavia situation, Sweden took the closest old Soviet Union model, which is so terrible that it's beyond description. There's only one choice. You go to doctor, which is assigned by government, or you die, or you suffer, you do sickness. But in Finland, it has developed that there's 2 systems. There's a private system which is used by middle class, and government is supporting the private doctors and hospitals so that the middle class are getting some benefit from the government. But basically, elderly and unemployed people, those who have a time to be in a 6 months waiting line or die in that time, they are who are taken care of by the government medicine. I'm sorry?
5 minutes.
5 minutes, thank you. So when I came out of Finland, I had already 30 years experience about the socialized medicine. Personally, I've been always so healthy that I didn't need the doctor, just a broken bones a couple times in a sports situation. And I'm 65 now, and I have always believed in alcohol, you believe preventive medicine, preventive attitude, and preventing whatever means you can do. And that's where my heart is, preventive medicine, preventive health care. So I'm adamantly against the socialized medicine because it's a stupid. We should have learned it from the Soviet system. It doesn't work. And Scandinavian countries are supposedly admired to be the best countries where there's the best government health care. And I know, go to Sweden and talk with Swedish people. It's probably worse than the Canadian or other system. So I tell in my testimony one specific experience. A friend of mine whose name is Ken Walrus, police officer in capital Finland, Helsinki. He had got athletic shoulder problem, needed surgery. He was put into 6 months waiting line. And he started to think about what he will choose. After 2 months, his salary will drop 60%. And in the 6 months, he loses so much salary that is better for him to pay the pocket and to save money. So basically, you have two choices. You pay it from your own pocket with a little bit less than losing in a waiting line your salary if you are a working person. So it's mainly for retired people, unemployed people who have all the time to be in a waiting line.
Really great.
So I hope that we can, by the Spirit of God, which has been the support, which has been the strength of the USA always, that we can resist this madness of socialism ever coming here.
I have questions. Is it all right with you folks if you come up here and just ask your questions rather than me walk around and make all that noise? Anybody have a question for Raymond?
Please speak.
Okay. On the way, on the way.
On the way, on the way.
On the way.
I have a poor hearing, so please speak loudly.
Raymond, how much did your taxes? How much were your taxes to pay for the health care versus what you're making now, if you can equate that?
You mean taxes?
Yeah, what were your taxes? How much were you paying for that universal health care in Finland
I think
compared to what you're
at middle class average tax is 50%. Yeah. So you count from that. If you are in a 30% bracket and you have 20% from your salary to put into private insurance, how much is that? Is that much better? And you can choose where you go, what you do, and your moral attitude to be preventive and self-reliant. So that's a much better deal.
Okay, thank you very much.
I just wondered if you saw the news last week where the Swedish finance minister came out and said the 70s through now were the lost decades regarding health care. Did you see
I didn't hear it, please.
Oh, okay, I'm sorry. The Swedish finance minister came out this last week
Where?
in the news. He spoke publicly and said that the 70s until now have been the lost decades for Sweden. And financially, they're going to have to change their system. And I just wondered if you saw that. No?
You know, that's very interesting because we understand that there are several countries that have tried the socialized medicine that are now trying to undo it. And so it's kind of like, we're kind of, why are we doing it? Behind the times here. Yeah. Okay, thank you, Raymond. Thank you very much.